Loud. All right, here we are. It is Friday afternoon, and it's about 3 o'clock here in Austin. And I'm Ashley Maltz. I'm the founder and CEO, I guess you could say, of the Austin Wellness Collaborative. And we are here with Christina Burke, who's the Strategic Partnerships and Advocacy Director at Compassionate Cultivation of Texas. And she is going to introduce herself and tell us how she became the, this role and what she does in general.
Okay, hi, thank you. Thank you so much for having me and having Compassionate Cultivation on this event today. Really appreciate it. My name is Christina Burke. I run strategic partnerships at Compassionate Cultivation. We are the only Texas owned and operated company under the Compassionate Use Program that is licensed in the state of Texas to produce and distribute medical cannabis for qualifying patients under the Compassionate Use Program. Part of my role there is strategic partnerships, but that also includes community outreach and advocacy, and any other kind of external outreach that we do in the community for not only our patients, but also for education and awareness purposes.
Wow, that's so cool. I just love that, you know, we have this possibility in Texas now because, I've lived in states where medical cannabis has been approved for years and, even decades. And it's, well, a decade, right? So about 10 years. But it's kind of new to Austin, to Texas, and I'd love to hear if you could tell us more about the Compassionate Use Act and what that is and about the program itself.
Yes, so the Compassionate Use Act was originally passed in 2015, and it allowed for low THC, high CBD oil to be produced and dispensed for patients with intractable epilepsy. That was the only condition it was approved for. And was approved by prescription only. It's still prescription only, but for intractable epilepsy with a prescription written from a board certified neurologist. In 2019, the legislator passed an expansion or voted to expand the compassionate use program to include a variety of other conditions that just really widens the scope on conditions in patients that are eligible for this program. So those included all of epilepsy and seizure disorder, not just intractable epilepsy, autism, multiple sclerosis, ALS, spasticity, did I say autism,
Mhm.
terminal cancer, and incurable neurodegenerative disease. Under that umbrella of the incurable neurodegenerative diseases, we're looking at, there's about 150 on that list, but those include Alzheimer's, dementia, Parkinson's, Huntington's, um, certain neuropathies, CTE, and a number of other conditions. It's a pretty extensive list.
Yeah, I've looked through that list quite a bit myself just because I see a lot of patients with chronic pain and, neuropathies of all kinds of different things. And, it's unfortunate that more diagnoses aren't included, but we know that that'll hopefully be coming in the future. And, at least we have something to go on. And I'm really proud of Texas for doing that. So, can you tell us how you got involved in this and how you came to work for Compassionate Cultivation?
Sure. Yes. So I did oil and gas for 17 years in Houston in my prior career and then moved with my family to Austin. After I left the oil and gas industry, I kind of wanted to do something a little more, in a sense, purpose driven, or a purpose that I was more could relate to so much. I mean, and so I was working at the Safe Alliance, which is a wonderful organization here in Austin, and through mutual friends, my husband and I met the founders and the CEO of Compassionate Cultivation. And, it just really hit a lot of check boxes for me in terms of things I could really get behind and things I believed in, not just personally, but just for Texans or, people in general. And so I kind of wrote a long email to the CEO and basically said, I need to come work here. This is, I want to be part of this from the beginning. And he said, okay. And we talked, met, and I came on board pretty early in the beginning, in December of 2017. And we were still what you would call a startup, maybe a growth startup, but back then it was a real startup. We had just received the final license in October of 2017, planted our first seeds in October 31st, 2017. I came on board in December 2017 and just kind of wore a million different hats and just kind of evolved and grew from there in the company as the company grew. And then we opened our doors in February of 2017 and served our first patients.
Great. Or 2018.
2018, right?
Yeah.
Sorry.
Yeah. I was like, that's a fast going backwards growing.
It's time travel, it's great.
Yeah. Well,
So
yeah, we are,
February
we feel like
2018.
we're in a time warp these days, doesn't it?
This is true.
Yeah. Well, that's so cool. So I'm also from Houston, so I get the whole, oil and gas industry and the medical industrial complex and all the things there. So, um, great. So tell us exactly how the compassionate use program works. Like, how does let's say you have a patient with epilepsy, or there is a patient out there listening, or someone or a provider who wants to potentially prescribe for, medical cannabis. How do they do that?
Okay, so it's actually not as complicated as it seems at first. It's kind of people look at it or read about it, and it seems a little daunting. It's really not that difficult. For a provider, on the provider side, they will need to be a doctor that resides in Texas, that is board certified in a specialty that is recognized by the American Board of Specialties, whether that's neurology or oncology, rheumatology, pediatrics, internal medicine, just as long as a board certified specialist. And they will need to enter themselves and put their credentials into the Compassionate Use Registry of Texas, which we call the CURT, CURT. And that is done and regulated through the DPS. So they go on the DPS website and they go and register, put in their credentials. It doesn't usually take that long. Their credentials are verified by the DPS, and within a day or two, they'll be accepted into the program. Once they're in the program, that's the doctor's role in terms of just getting signed up into the program. For the patients, on the patient side, they will need to go to a doctor, whether it's their doctor that's already registered or could register, go to a doctor that is in the compassionate use program, and verify that or be diagnosed or prove diagnosis of one of the qualified conditions. They have to be a permanent resident of the state of Texas. And once they are, deemed that they're qualified, the doctor will put in their prescription through the compassionate use program. It's all done on the registry. There's no medical cards like in some states. And once the patient's in the registry for those, for whatever condition and treatment plan, the patient usually, or the doctor's office, but usually the patient then calls Compassionate Cultivation, and we take it from there. We walk them through the entire process. We walk through what their dosing looks like from the doctor, what the ratio, and because our medicine comes in different ratios depending on the symptom that's being treated or condition. And we walk them through the process from there. We have a whole team on staff that is they're great. They're patient care consultants, we like to say, because we do walk them through. Once their prescriptions in, we take it from there, and then we get their prescription filled, and we give them options for our statewide delivery or pickup options.
Cool. Wow. It doesn't sound that hard.
No,
Now,
I think people think it's more complicated than it is.
I have a few questions to follow up. So, can physician extenders be part of the CURT program? So, like nurse practitioners, PAs, or no?
No, they're not qualified to register in the program. However, a lot of doctors in their practices, the nurses or the nurse practitioners or MAs are the ones that kind of put in the prescriptions and the medication, and kind of works on that, getting their prescriptions in. So a lot of the providers, it operates the same way. They are the registered physician, but their nurses or nurse practitioners or MAs go in and actually kind of put the prescriptions in, but that's really between the doctor and his staff of how they choose to handle that.
Right. So the doctors, like myself, would need to know the dosing, and have to write the exact dosing on the prescription, correct?
Well, in the registry, there is an option for providers to, you look at the dosing, and we do have dosing guidelines from our chief medical officer, who is a practicing pediatric neurologist and epileptologist. And we're also gathering more additional dosing information from other physicians that are kind of treat other specialties to add to that. So it helps because it is new. So
Yeah.
in the registry, there's a whole dosing section, and you can put in, for example, if they're going to do 5 milligrams twice a day. So they'll put in, the drop down, 5 milligrams. It can be dropped down once a day, twice a day, or as directed. Then there's a opening where they put, they'll put the ratio that they want. They'll
Hmm.
put their dosing, and then they can put, say, 5 milligrams twice a day at bedtime and in the morning. It kind of describe out, put a more descriptive prescription of what that looks like. And
Okay.
then we walk the patient through that. The syringes that the tincture comes in, for example, are done in milliliters. As you know, the syringes are milliliters, but the prescriptions are milligrams. We help the patients with conversions on that sort of thing and get it through. But it's pretty user friendly. Once you get in there, there's lots of options, and there's plenty of place to put notes in there for what they want. It could be, even if it's a titration schedule, if you want to start off at 2.5 milligrams twice a day, and then move up to 5, or move up to, say, 2.5 milligrams or 2.5 milligrams every 2 weeks until you hit a goal dosage of this, or till you start seeing effects, or as you can handle it, as you see fit to handle it. So it it really depends on what the doctor wants to do, but there's plenty of options in the registry to where they can get detailed in their dosing.
Cool. I like that. It's,
Mhm.
because it is brand new to
Mhm.
us. We didn't get training on this in our residencies or in med school or anything. So it would be helpful to have those kind of, you know, not hand holding, but hand holding virtually,
Absolutely. We
just in the beginning at least.
Yes, and we have a medical advisory board and doctors that we really work closely with, that do in fact reach out to other doctors when doctors have questions about dosing, like, where do I start with this? And we have guidelines, like I said, from our chief medical officer. But we do have doctors that work closely with us to help with dosing recommendations and that sort of thing.
Right. Great. Because there are no guidelines
No, there
like
is not.
standard, you know, like a there it's all new medicine for us. And so like there's no like American Academy of Family Practice has specific guidelines or anything, or the USPSTF, United States Preventive Task Force. That's not their goal. They're doing preventative screenings and things, but there's no actual guideline. So we kind of would have to play it by ear. And there's the art of medicine that comes in with that. And every patient's going to react differently, I presume. So that's so cool. Now, is Compassionate Cultivation the only medical cannabis dispensary in Texas?
We are the only dispensary in Texas, but there are 2 other licensees that do have licenses under the compassionate use program in Texas. We are the only Texas-owned and operated,
Okay.
one of these licensees. The other 2 are, while they do operate in Texas, they're based in Florida.
Okay.
But we are the only dispensary.
Yeah.
Um, the other 2 are delivery only. They
Okay.
don't have an actual dispensary where you can come in and pick up your medication.
And you guys grow your own cannabis?
Yes. By
Okay.
law, it has to, we have to be vertically integrated. We go seed to sale. That is part of the compassionate use program laws. So we do on site in our facility, just south of Austin. You grow it from, literally from seed to sale, manufacturing, extracting, testing, dispensing. It's all in under one roof. It's all vertically
Cool.
integrated.
Wow.
Yeah, you should
Yeah.
come visit. In fact, we with COVID, it's been a little difficult to host tours, but we have enforced some pretty strict sanitation guidelines, and we do really encourage groups such as yours, doctors, patients, to come and visit and see our facility firsthand. It really is state of the art, and it's more like a biotech lab almost, that just happens to have
Right.
flower rooms in the back. It's super impressive, and we have a team of experts, cultivation, extraction, manufacturing, PhDs on staff, and all kinds of titles that I don't understand or can't pronounce, but it's super impressive.
Yeah, it sounds exciting. I'm curious as to the actual growth process. Like, how do they? I mean, I'll eventually, hopefully, maybe we can host a AWC tour once the pandemic's over. But I'm curious, like you mentioned flowers. So is it you're do you have the whole plant? Is it a greenhouse? Are they outdoors? I'm just curious from my own.
For a medical product, it needs to be a controlled indoor grow environment, and that's what we have. So when I say flower rooms, we have flower rooms, we have vegetation rooms. Each of those are built and set up to support the plants at different stages in their growth.
Yeah,
And we have light schedules that mimic natural light and maybe even a little accelerated on the light program to just really be efficient in our grow and maximize the amount of flower or which is the part of the plant that you retrieve the CBD and THC from. So we have our, like I said, our flower rooms, our vegetation rooms. We have a breeding program where we do hybrids and we breed our own strains to really focus on strains that, really are, zero in on the symptoms that we're trying to treat, which is really, it's super interesting. It's really fascinating. And then we have our dry cure rooms and manufacturing. So
yeah,
it's all indoor, it's all very controlled, chemical free, pesticide free. We don't use anything that's not natural in our facility for our
that's something
process.
that a lot of our users would be.
Yes.
Sorry, not users. I mean, the people
Mhm.
listening
Yeah, yeah,
would be interested in because a lot
yeah,
of us are holistically
yeah,
oriented and want the least amount of residues and toxins in our products. So
mhm,
that's fantastic.
yeah.
Can you talk more about that hybridization and how they're specific for specific like symptoms and what some of those symptoms might be? I'm just curious about.
Sure. I can't really, I can speak a little bit towards the cultivation piece, but that would be really better answered with one of our cultivation experts. And I'm happy to get one of them to come and speak because it is beyond fascinating. But in terms of what we're looking at is growing specific strains for specific treatments. One of the things that the expansion also did in 2019 was remove the floor on CBD. And that allowed us to create ratio based formulations that really targeted certain symptoms. So some symptoms are better treated with a higher THC. So not
Mhm.
so much higher THC. We're only allowed to have each bottle of our medicine. We have three ratios: 1 to 1, 3 to 1, and 20 to 1. Each of those have 150 milligrams of THC per bottle. The difference is the amount of CBD. So we call them balanced or high CBD formulations. For example, most of our epilepsy patients really are seeing improvements with the high CBD, the 20 to 1
Mm,
formulation. But if you're treating something like pain or neuropathy, or tremors, we tend to go towards the more balanced. So you have less of the CBD because the CBD offsets the effects of the THC
yeah,
in the endocannabinoid system. So you're offsetting the more CBD you put in the medicine, the more you're offsetting the effects of THC. If you're treating something like autism with high anxiety, then you want to have more CBD in that to because the CBD is what kind of helps with the anxiety. So it's all about the symptoms and those are the specific, the ratios. And this is through research that said, okay, these types ratios work best towards these symptoms.
that's so cool. I love that. Yeah,
Right.
because
So different strains, do we grow higher THC strains or higher CBD strains? Or, there's also terpenes, and that's a whole nother conversation. And what strains have the terpene profile that we're looking for certain symptoms. So we're looking at that constantly in our breeding program. Like I said, when you guys come out to the facility, it's fascinating.
yeah, I'm sure there's you can probably smell it outside.
You can, and when you work there and you come home, especially after harvest, you smell very distinct.
Yes. It remind I can never tell if it's cannabis or a skunk. They're kind of similar, but I am curious about that high that
Mhm.
people, with traditional marijuana would get, high versus tell me about with medical cannabis.
Sure. I mean, it is a natural it's a natural substance or a natural medicine. So everybody is going to metabolize this differently. And there is THC in it.
Mhm.
But all of what the effects of this medicine, it's different with everyone. And so, it depends on your weight, your dose, your other medications you're on, uh, what is your tolerance to other medications and how your body metabolizes it. We have not had really many reports of people feeling, say, euphoric. But it is a natural medicine. Everyone processes it differently, and it does have THC in it.
Mhm.
So, it's really individual, and we're still, all the doctors are, they are aware of the dosing and what other medications. So again, it's really hard to say, yes, this is going to get you higher. No, it's not, or
Right.
however you want to word that.
So, like, for children per
Hmm.
se, like, I would imagine they're most, they could have cerebral palsy with
Hmm.
spasm,
Hmm.
or anxiety and autism and all those types of things. You probably wouldn't want to dose them up on, you would want higher CBD blends for the kids because we don't want them to get high per se.
Right. Or if you do on, say, on the more balanced formulations, depending on the symptoms you're trying to treat, a lot of doctors, like other medicines, from what I've heard from our MAB and other physicians we work closely with, is start low and slow. And a
Hmm.
lot of times you're seeing success at lower dosages. So, a lot of times you don't get to those high dosages where you run the risk of the effects of the THC being very prominent.
Gotcha.
And, with young kids, a lot of times if it's, say, epilepsy or autism with disruptive behaviors or high anxiety or insomnia, balance like maybe the 3-to-1 or the 20-to-1 with the more of the CBD is the effect. But it's, you start low and slow
Yeah.
just to see where you're going to hit like the sweet spot of success where you're seeing. And so we have not come across any issues with that.
Yeah. Yeah. I'm sure just if they have unrelenting epilepsy and they're not having that anymore or
Mhm.
much lower dose, frequency of their seizures, then that's like, you know, okay, if there's a little extra THC, I mean, in my opinion, that's just my opinion. Like, I don't see children, but as a physician, but that's give them a life that is, they can function in would be great. So, and so what if, or so does insurance cover cannabis or no?
It does not. It's still federally illegal and it's not FDA approved. So
Yeah.
insurance does not cover this. It is out of pocket, cash or check only. However, if you do have an HSA or FSA health savings plan, because that is self-funded, we can accept those cards in the dispensary if it has a PIN number, or you can get reimbursed for those expenses through an FSA or HSA health savings plan, but insurance does not cover it.
How much does it cost and how does it come? Like, I'm sure there's different formulations like
Mhm.
edibles and tinctures and things.
We have a tincture, coconut oil based tinctures. We also have a mouth spray, and that was developed a lot for, especially during with sorry, I just can't get the words out. Kids that can't or
Yeah.
thought, they drool a lot or can't hold something or don't or refuse to hold the oil in their cheeks, so you just spray it in your mouth and absorbs in your cheeks very quickly. And then we also just announced lozenges, and lozenges are about the size of a Skittle, and those are really good for patients that might have oil sensitivity or on a higher dosage because it is based in coconut oil.
Mhm.
Sometimes an excessive amount of coconut oil or any carrier oil can cause some GI irritation. So the lozenges are an alternative for that. And they're like just a little candy. And
Cool.
so for cost, depending on it depends on your dosage, what your true, say, monthly cost is. But our bottles run anywhere from $75 to 342, depending on the ratio you get per bottle.
Cool. Okay.
Mhm.
And then how do you find a doctor who's on the CURT program and what if can't find someone?
Well, there's several different options for that as well. There's the doctors listed on the CURT program are publicly listed on the DPS Compassionate Use Registry website. We also, I don't know that we put them on our website. I don't think we do put all the doctors because it would have to link into, and that'd be hard to maintain. But we also, what we do is we also have a team that will pair somebody with a doctor. If their doctor is unable or unwilling for any reason to prescribe this, whether they're not a specialist or their hospital system doesn't support the program, or they just don't feel comfortable prescribing, and everyone has their own
Right.
opinion, and that's fine. So if your doctor is unable or unwilling or not, to prescribe this medicine, we do have a team that matches doctors with patients. And that's for the sole purpose of getting a prescription. Now, that doesn't mean they have to terminate their relationship with their primary caregiver. They can still have that relationship and go to another doctor just for the purpose of this prescription. But we always encourage people, if they do that, to make sure that they tell all their care providers that they are on the medication, and disclose anything just like you would any other medication. But we can match people with physicians. There's about 254 physicians around the state, and especially during COVID, several are doing telemedicine.
Right. That's
Mhm,
so cool.
mhm.
Well, I love that this is becoming, is an option for people because, it does have benefits from what I've seen and from living in other states where it has been more legalized. So is there anything else you wanted to mention or like that we didn't talk about?
Not only do we have a team to, like I said, walk a patient through the program, if someone's watching this, either a prescriber, a potential prescriber, or a patient, and they have questions about, maneuvering, navigating through the program, we're there. We have a team that helps people navigate through this program, both, like I said, prescribers and patients.
Yeah.
We also, on our website, there is a ton of information for both prescribers, including dosing guidelines, and patients, and research, including research on the qualifying conditions, how to get involved, how to help, who to reach out to in order to hopefully get this program expanded in the 2021 legislative session. And also our success stories. One thing I love to share with people are our success stories. We have patient testimonials and success stories on our website and on our YouTube channel. And
Mm-hmm.
these are very powerful. And it's hard to deny the real power and truth of this medicine. It is a natural medicine when you see stories. It ranges from epilepsy patients, autism, MS, ALS, Parkinson's, Alzheimer's, and these are patients sharing their stories to hopefully help and educate and remove the stigma of this medicine. It's truly changing lives.
Yeah, I love it. I apologize. My dogs
That's
tried
okay.
to hunt me down in my room where I had gone away from them originally in the living room because they were barking. Um, but yeah, I think it's great, and I think it's just the beginning of the uses of cannabis as
Yeah.
we explore and get more research on it and all the benefits. Are there any uh, are there any contraindications for people being on it?
What we've heard, there's a few medications that do interact with
Yeah.
CBD, and I wouldn't say interact it's more of like some increased liver enzymes, and so a lot of doctors, if there's the risk or they're taking those medications, they kind of do the panels monthly or every couple of months to make sure, but that's very rare. The biggest side effects that have been reported to us are somnolence, sometimes extreme sleepiness at first until your body gets used to the medication. Sometimes some GI issues, especially if you're on a higher dose and you're taking more oil. Um, those are really the most common. Increase in appetite sometimes,
Yeah.
depending. We
Which
have,
could be good if you have
especially,
anorexia from cancer per
yeah.
se, or some,
And, some people even welcome the GI irritation because if they're on other
yeah,
pain
opioid,
medications and want to wean themselves off, it just
right?
helps keep things moving.
Or yeah, like chronic pain. I'm
Yes.
sorry that my little
That's
children.
my dog's at my feet.
Yeah, they of course they have to interrupt in the middle of this taping, but
Course.
anyway. Um, Yeah, so I think it's exciting, and especially given the opioid crisis and that we're
Yeah.
in, and
Yes.
doctors are seeking out other ways to treat pain and to treat anxiety and to treat all these other conditions. So I'm excited, and I appreciate you coming on and sharing what compassionate cultivation is up to, and hopefully we can, you know, keep going and decrease that stigma, because it's really important that
It is
that get
important.
this medicine if they need it.
Mhm. And it is medicine, that's one thing we say, this is medicine. And yes, thank you for having us. And when we get through this latest
Yeah,
thing, COVID, we would love to host an event for you guys out at our facility. We've done that in the past. It's well worth your time. We love showing it off, and
yeah,
it really, seeing it really, if there's people that come in and there's any doubt or question marks on, is this really medicine or is this safe? I would say 9 times out of 10 they walk away, if not more, 10 out of 10 walk away, and their mind and their viewpoint has really changed and
yeah,
how they look at this medicine.
yeah. Well, it's been around since since there were humans, and now we're just there's a long political and
Yeah,
history that I'm aware of. So um, you know, we'll see. Things are changing, and
things
it's
are changing quickly.
yeah. So, well, thanks so much. How can people? What's your website so they can get
Our
more information?
website is www.texasoriginal.com. Like I said, I highly recommend. You can always call the dispensary at 512-614-0343 or email info@texasoriginal.com. Like I said, we have a team that is there to answer any questions and help physicians and patients navigate through this program. We make it very easy. We pride ourselves on our customer care. It is our top priority there. So I think that they would have a good experience.
Awesome. Well, thanks so
Thank
much.
you for having us. I really appreciate it. I'm
You're
excited.
welcome. Hope to see you guys in person at some point.
Yes, me too.
Yeah. And until then, stay well and keep on going.
Thank you so much.
All right. Have a great day.
You too.
Take care.